Do you recently adopt a dog? Have a dog? Do you really want to know how to take care of the dog? Do you know concern about their health? Do you want to read about them? So let's talk about their care routine of the dog and their health management.
First, feeding a dog. Feeding your dog with a high quality food, you must read the prospectus food first. The ingredient must contain meat, not meat just byproduct or grain. This you will know that the food is high in quality, high in protein and good for your dog, not just a filler. The number 2 is feed your dog on a right schedule. Feeding your dog twice a day. And ask for recommendations by your vet according your dog's problems. Vet may be able to steer toward a food that's just right for poop and recommendation how much to feed. Avoid on giving your dog an excessive amounts of treats or people food, and also give your dog water.
Next, caring for the health of the dog. First, we have to make sure to have a good and reliable veterinarian. This is because we will need to bring our dogs to veterinarian regularly. In order to find a good one, we may look at how the veterinarian interacts with the dogs. If you have any question to the veterinarian, he or she may answer directly and knowledgeably. Hence, we have to note that which emergency vet that's open 24 hours and on weekends. Important is we have to get our dog vaccinated. Vaccinations are kept up to date with regular booster injection, depending on the disease, which may be yearly or 3 yearly. Third, we also able to consider fitting the dog with an ID chip. The ID chip will be a small chip that is injected under the skin over the shoulder blades of the dogs. The ID chip will benefit us when our dog being stolen or lost, as it has unique number registered with our contact details on database. After that, we have to use regular parasite preventive on dogs. It is important to treat regularly with basic worming against roundworm. After that, we have to use regular parasite preventive on dogs. Every dog, like hunting dog, may need monthly treatments, whereas our dog with low risk may only need a roundworm treatment 2 or 3 times a year. Get your dog a health insurance. Get your dog a health insurance helps us to cover the cost of veterinary treatment as in exchange for a monthly premium. The insurance will cover majority of the cost up to certain limit if our pet is sick or injured. But we have to revise on how we can afford monthly for the premium and investigate several companies that what level of coverage they will provide.
Grooming care for dogs is necessary. Brush the fur, keeps dog's coat clean. Which use with a brush or a comb and groom it regularly. Regularly grooming will help to remove dirt, spreading natural oils through her coat, preventing tangle and keep skin clean and irritant free. In grooming, we can help to check for fleas and fleece dirt. Secondly, shedding old or damaged hair is depend on the health, breed type and season. Keep dog nail trimmed regularly. This will help the dogs to walk easily and no sleep problem.
Exercising, socializing and playing with your dog. Provide your dog with plenty of exercise. Provide the right amount of exercise for the type of dog you have. A small toy dog may be better playing games of fish or ball to tire it out, while a rubber dog needs to have good long walks for at least 30 to 45 minutes twice a day in order to burn its energy. You may have a dog that actually requires a ton of exercise and never tires out. For example, terriers are often capable of running all day without tiring. Lots of exercise help burns off excess energy, which if unattended could cause behavioral problems such as chewing, digging or excess barking. Make sure you walk your dog. Your dog should go at least 2 small walks or 1 big walk a day. The length of these walks varies depending on the type of dog you have. No one wants their dog to run away. If you have a yard and you allow your dog to be outside by itself, make sure you have a fence in your yard so the dog can't run away. Make sure it's tall enough for your dog not to jump over. The third one is socialize your dog. Dogs need to be well socialized in order to become well-adjusted adults. From just a few weeks of age, introduce the pup to as many different people, sight, sound, and smell as you can. What it encounters up through 18 weeks of age, when the socialization window closes, it will largely regard as normal and not be fearful of in the future. If you got the dog as an adult, then you still need to introduce it to different experiences. Take care not to overwhelm the dog and make it fearful if it is not comfortable. This requires patient handling, whereby you introduce the dog to the fearful object, but at sufficient distance that it does not alarm the dog. Reward calm behavior and over time move the object closer, rewarding as you go so it starts to build a positive association with the sufficient distance that it does not alarm the dog. Reward calm behavior and over time move the object closer, rewarding as you go so it starts to build a positive association with the object. Allow the dog to play and display behaviors that are normal for the breed. For example, scent hounds such as bassets and bloodhounds live to follow scent. Make sure you give your dog time to sniff its environment. You may even wish to turn this into a game where you lay a scent trail and it gets to follow it.
Treat your dog with respect and love. The first is register your dog and put tape on its collar to help ensure that your dog will make its home if get lost or separated from you. Next, treat your dog with respect. Never punish with physical force or demand the dog in any way. Next, be aware that your dog has basic needs that need to be fulfilled. For example, your dog needs a change go to the toilet regularly without soiling the house or itself. Next, make sure your dog has access to a comfortable place to sleep and is not leashed out in extreme temperature. Keep your dog inside during the extreme weather, but if you cannot, make sure your dog have access to a good dog house and a lot of water.
Importance of veterinary care. A dog should have a complete veterinary examination at least once a year. Puppies need a veterinary visit usually every 3 to 4 weeks until they are about 4 months old. Geriatric dogs older than 7 to 8 years old should see their veterinarian twice a year or more frequently because illness is more common in older pets and it can be identified sooner. Sign of illness. Because of you are more familiar with your dog than anyone else, you should watch it careful for subtle signs of illness that another person or even a veterinarian might miss. General signs of illness include a lack of appetite or decreased activity. Other more specific signs include vomiting and diarrhea, urinating more or less frequently, pushing on sneezing, or a discharge from ears, eyes, or nose. Illness can also show up as a loss of hair or itchy area on the skin or around the ear. Problems with the musculoskeletal system are often seen as stiffness or lameness, such as not putting weight on a leg. If your dog shows any of these signs for more than a day or two, a visit with your veterinarian is a good idea. Giving medication. Pills and chewable medication are usually relatively easy to administer to dogs. Most dogs will readily eat a pill that is hidden in small treats, such as a piece of cheese or a bit of peanut butter. Sometimes, generally holding the dog muzzle closed until you are sure that it has swallowed can be helpful. Liquid medication are sometimes prescribed, particularly for puppies. Liquids can be given via a syringe into a rear of dog's mouth by inserting the tip of syringe near the back teeth on either side. Holding the dog head pointing partially upward can help prevent spill. Spoiled on products or other topical medication are administered directly on the coat or skin.
Vaccination. Vaccination is a key component of preventive medicine in dogs, just as in people. Vaccinations are given to stimulate the immune system against infections before exposure to a disease. Several vaccines are routinely given to dogs as the core defense against a serious infectious illness. For example, distemper, parvovirus, rabies. Several others, referred to as non-core, are important in certain regions and situations. For example, Bordetella, Lyme disease. Your veterinarian can advise which vaccines are necessary in your local area and circumstance. Parasite control. The primary intestinal parasites of dogs include roundworms, hookworms, whipworms, and tapeworms. These worms damage the digestive tract or interfere with absorption of essential nutrients for both. Intestinal parasite infections are diagnosed by finding worm eggs or sometimes actual worms or worm segments in fecal samples. Fecal samples should be tested periodically, yearly or on the schedule recommended by your veterinarian in all dogs, and more frequently in puppies, which are especially prone to parasite infection. These worms usually do not cause intestinal infection in people. However, hookworms infections leading to abdominal pain and inflammation have developed in people with weakened immune system. Roundworm larvae also have the potential to infect people. When infected roundworm eggs are ingested, they can develop into larvae in the intestine and potentially migrate into sensitive organs. This migration is much more likely to occur in children and people with weakened immune systems. Sanitation is key to prevent because roundworm eggs take about 30 days to become infected. Thus, promptly cleaning up feces from your yard can essentially eliminate potential exposure. Common external parasites include fleas, ticks, and mites. Monthly preventive treatments are available to control fleas and ticks and are administered as body spray or spot-on preparations that are placed on the skin between the shoulder and blades. Mites can be detected by scraping the skin of infected areas for signs of mites or their eggs. Signs of mites include red, scaly areas, or bark patches on the skin or paw. Dental care. Dogs need dental attention throughout their lives. You can help keep your dog's teeth and gums in good condition by feeding dry food, providing certain toys, for example flossy style bones, brushing your dog's teeth regularly, and following a program of professional dental cleaning and oral care performed by your veterinarian. Good dental care reduces the development of plaque, which, if untreated, can progress to gingivitis and periodontal disease. In severe cases of dental disease, extraction is common.
Now I want to present about grooming. Grooming hair coat should be brushed regularly to remove sheath hair and prevent hair mate. Grooming is important for dogs with thick or shaggy hair coat that mate or tangle easily. Mate should be removed by electric clipper, not scissor. Periodic bathing with pet shampoo is also important for maintaining healthy skin and fur. On average, most dogs do not need to be brushed more than once a month. Next, we go to the household hazard. As 3 points added. First one is dog must be protected from household hazard, especially curious pupil, that tend to investigate and show everything. Second, dangerous item, especially electrical cord, can be frequently coated with a full testing spray. Last one is element of house design also pose potential hazard for pets. Okay, now the spaying or nurturing. All dogs should be spayed or neutered unless they are to be used for breeding. This prevents unwanted puppies and avoid potentially serious future medical problems. Spaying and neutering can also improve behavior.